Good morning, everyone. Today, we will be discussing one of the most significant global health challenges of our time, COVID 19. Since its emergence in late 2019, COVID 19 caused by the novel coronavirus SARS CoV 2 has dramatically altered lives, economies, and healthcare system worldwide. First, let me introduce the presenters that consist of my group members. Name first, Nurauda Wadiha binti Muhammad Fauzi. Second, Ain Shafika binti Norizam. Third, Fatiha binti Azman. For Nurul Farah Ain binti Rahazil and Isham. And lastly is me, Asmanuha binti Shafuddin. In this presentation, we will explore on the issue or problem regarding this topic, objective of the topic, changes or challenges that people face during and after COVID-19 pandemic, and finally its resolutions. We will also examine the public health response, including the development and distribution of vaccines and the ongoing efforts to manage and mitigate its impact. By the end of this presentation, we aim to provide a comprehensive understanding of COVID-19, highlighting key lessons learned and the path forward as we continue to navigate this unprecedented global pandemic. Thank you for joining us as we dive into this critical topic. Thank you. COVID-19 is caused by the SARS virus and first detected in Wuhan and was confirmed on January 12, 2020. Malaysia restricted from receiving newcomer after first case in Thailand suspected. Malaysia went through two phases of COVID-19, first by March 2020 and second by April 14. And then government made a move by conducting MCO on March 18, 2020. NGO also started to provide protective equipment for frontliners. In conclusion, the pandemic has affected many millions of lives in Malaysia.
Hi, my name is Nurul Wadiha binti Muhammad Fauzi. I would like to present about issue and problem side effect on COVID-19 to public people. The COVID-19 pandemic highlighted numerous global, social, economic, and public health related policy issues that impact crisis management and alleviation. First, inconsistent public health messaging. Inconsistent public health communications during COVID-19 causes uncertainty, confusion, and damage to public confidence. Controversial information about virus severity, safety precaution, treatments, and vaccination, along with conspiracy theories, hampered pandemic response. The next issue, delayed response and preparedness. The COVID-19 pandemic exposed significant weaknesses in international health systems due to insufficient planning, delayed response, and shortage in emergency supply. Governments reduced in emergency procedure and insufficient reverse contribute to the virus rapid spread and poor treatment. The third problem policy in COVID-19 is inequitable access to healthcare and vaccines. Systemic problems like bias and language difficulties compound healthcare inequalities, which the COVID-19 pandemic exposed and made structural improvements necessary, especially like low income and rural residents. The next point is economic and social policies. Stronger social and economic policies are required to combat food insecurity, unemployment, and unstable housing, especially for low-income and marginalized groups, as the COVID-19 pandemic has brought to light. Final point, data and privacy issues. Along with worries about data security and privacy, the COVID-19 pandemic has raised concerns about civil liberties, government access, and data accuracy. The situation emphasized the need for transparent, accountable, and equal access to digital service in public health efforts. That's all from me. We move to the next presenter. Thank you.
So here is an explanation for each key objective of studying COVID-19 cases. Number one is understand virus transmission patterns. By studying COVID-19 cases, researchers can analyze how the virus spreads within communities, households, and different environments. This understanding helps in implementing targeted measures to break the chain of transmission. Number 2 is assess health impacts on individuals and populations. Research on COVID-19 cases allows us to assess the severity of the disease, its symptoms, and the varying impacts on different demographics, example, age groups, underlying health conditions, and many more. This information guides healthcare providers in delivering appropriate care and resources. Number 3 is develop effective prevention and treatment strategies. By studying how COVID-19 cases progress and respond to different interventions, scientists can develop and refine strategies such as vaccines, therapeutics, and public health measures like mask wearing and social distancing to reduce transmission and severity of the disease. Number 4 is inform public health policies and interventions. Data from COVID-19 studies inform policymakers on implementing evidence-based interventions and guidelines. These policies aim to mitigate the spread of the virus, protect vulnerable populations, and manage healthcare resources effectively during outbreaks of future pandemics.
Hi, my name is Nurul Farah Ain. Today, I would like to present about change post-COVID-19. Firstly, one of the most noticeable changes about COVID-19 has been the increased emphasis on hygiene and sanitation. Malaysia has become more conscientious about personal hygiene, with frequent hand washing and the use of hand sanitizer become standard practices. Public space, including malls, restaurants, and public transport, have implemented stringent cleaning protocols to reassure the public and prevent the spread of the virus. The wearing of face masks has also become a norm in crowded areas, reflecting a newfound awareness of respiratory hygiene. Next is social interaction have undergone a remarkable transformation. The pandemic necessitated physical distancing measures, leading to the adoption of remote working arrangement and virtual communication tools. Malaysians have adapted to conducting meetings, classes, and even social gatherings online, leveraging platforms like Zoom and Microsoft Teams. This shift has not only facilitated continuity in education and businesses, but also altered perception about the feasibility of remote work in various sectors. Next, economically, COVID-19 catalyzed changes that are likely to have a long-term implication. The pandemic highlighted the vulnerabilities of certain industries, prompting a diversification of economic strategies. Malaysia's digital economy saw accelerated growth as businesses embraced e-commerce and digital payment solutions to adapt to changing consumer behavior. Furthermore, the pandemic spurred innovation in healthcare technologies and pharmaceutical research, positioning Malaysia as regional hub for medical advancement and vaccine development. Healthcare system in Malaysia experiences profound changes during the pandemic, necessitating adaptation to meet the demands of testing, treatment, and vaccination. Public health campaign promoting vaccination and adherence to health protocol become widespread, contributing to increased public awareness and participation in healthcare initiatives. Telemedicine services gained popularity as Malaysians sought alternative ways to access medical advice and treatment while minimizing physical contact. And next is education underwent a significant transformation as schools and universities adapted to the challenges of remote learning. The Ministry of Education implemented online learning platforms and blended learning approaches to ensure continuity in education. While these changes present initial challenges, they also spur innovation in educational technology and pedagogical methods, potentially shaping the future of education in Malaysia. That's all. Thank you.
Next is the challenges of the COVID-19. The first one is transmission control. The pandemic COVID-19 has posed numerous challenges to public health, including transmission control. Controlling the spread of the virus has been challenging due to its high transmissibility, especially in dense population area or setting in indicate public health measure. One of the most critical aspects of managing this pandemic is controlling the transmission of the virus. By wearing a mask, individual can significantly reduce the risk of spreading the virus to others, particularly in indoor and crowded setting with physically distant may be challenges, as well as in the era COVID-19. Next is overwhelmed healthcare system. One of the primary challenges stemming from the COVID-19 pandemic has been the strain of healthcare system. Hospital and medical facility has been overwhelmed by the influx of COVID-19 patients, leading to shortage of bed, medical supplies, and healthcare workers. The unprecedented demands for critical case has forced health system to adapt rapidly, implement sugar plan, and repose resources. Additionally, the stance on healthcare worker physical and mental well-being posed by significant challenge, necessitating support mechanism and strategies to mitigate burnout and fatigue. Next is mental health crisis. Next, the challenges of COVID-19 is a mental health crisis. The mental health toll to the COVID-19 pandemic is a processing concern that warrant attentions. Social isolation, economic uncertainty, grief, and trauma associated with the pandemic has contributed to increased rate of anxiety, depression, and other mental health disorder. Access to mental health service has been limited by resources constraints, stigma, and disruptions to traditional care delivery model. To address the mental health crisis, investment in the mental health infrastructure, telehealth service, and community-based support system are imperative.
Hi all, my name is Fatiha binti Azman and I would like to present about resolution of COVID-19. The COVID-19 pandemic has reshaped global public health, posing unprecedented challenge and necessitating innovation response. One of the most promising avenues to address the health impact of COVID-19 is through large-scale vaccination campaign. Vaccines have been very effective in preventing several illness, hospitalization, and death from COVID-19. To achieve herd immunity and control the virus spread, concerted efforts are needed to scale up this campaign globally. Government, public health agencies, and international organizations are working together to establish distribution channel, prioritize target group, and allocate vaccine doses based on factors like population size, disease burden, and health infrastructure. Coordination between manufacturer, logistic provider, and healthcare system is essential to ensure the timely and efficient delivery of the vaccine to vaccination site. In addition to vaccination, public health measures like wearing masks, practicing good hygiene, and maintaining physical distance has been crucial in controlling the spread of COVID-19. These measures have proven effective in reducing transmission rates, especially during periods of increasing community transmission. Strategic testing, contact tracing, and isolation protocol has facilitated early detection and containment of outbreak, preventing further infection and reducing the pressure on health system. Global cooperation is also vital in addressing the pandemic. International cooperation in sharing scientific knowledge, resources, and vaccine is essential to address global health inequities and ensure equitable access to vaccine for all countries regardless of income level. Initiatives like COVAX has been instrumental in facilitating vaccine distribution in low and middle income countries, highlighting the importance of solidarity and collective action. Sharing information about the virus, its spread, and its impact has helped scientists and doctors develop treatment and preventive measures. Additionally, countries support each other with medical supplies, equipment, and staff has strengthened health system and saved lives.
In conclusion, the COVID-19 pandemic has profoundly impacted global health, economies, and societies, highlighting the critical importance of global cooperation, science-driven policies, and public health measures in addressing such global health crises. Thank you.